Hi everybody, we're here today to talk about why younger generations must educate their elderly parents about healthcare and money. If you're an adult child with parents, there are really a couple of very simple reasons that may be a little selfish, but in this case, being selfish is good. Talking to your parents about healthcare and money will allow you to worry less about your parents' health problems as they age. They will also allow your parents, if they're willing to listen to you, to live happier and healthy lives. And most of all, by having these conversations, you can learn about future care expectations that your parents have for you in being their caregiver that you have never ever thought about that happen. I know, if you're a Gen Z or a millennial, this may be new territory for you unless you are already a family caregiver. If you are a baby boomer, you may not be so surprised because you may already have friends who are already caring for their parents and sharing these stories with you, and you're thinking, oh my God. So if so, having the conversation I'm about to share with you today can be very, very helpful. So if you're an adult child, younger or older, why educate your parents about health and money? I'm going to share 2 thoughts for you about health care and 2 thoughts about money. Plus, how on earth do you start these conversations? Because if you're younger, you may be uncomfortable talking to your parents about these very uncomfortable topics. So, before we go on, you might wonder how I have the experience to talk to you about this. I'm Pamela D Wilson. My website is PamelaDWilson.com. I'm a caregiving expert and an expert witness with 25 years of professional experience. I talk to families about health, healthcare, money, legal issues. I help families solve the problems that happen when they don't have these conversations. I've also seen the very positive things that can happen when they do. So you can learn more about me and my professional experience by going to my website, PamelaDWilson.com. You can also schedule a one-on-one individual or family consultation with me. There's links in the comment section below this video, or go to PamelaDWilson.com, click on Services tab, Elder Care Consultation, and fill out the form there. So let's start with some background information that's helpful for this conversation. Middle-aged parents are more interested in their children's lives if they have children, according to a lot of research and information that's out there. More interested in their children than their aging parents' lives, if their parents are still living independently. So for obvious reasons, parents should be more interested in their children, especially if children are young, under age 18, but even after 18. All the information out there shows that parents remain interested in their children's lives. Now, here's the catch. Depending on parent-child relationships, parents can be more stressed out if you're a young or middle-aged child and they're worried about your health, your job, your partner, or they may be a little distraught if they disagree with how you're living your life. None of these probably surprises you at all because you've probably heard their concerns. But the positive thing here is, if we assume that your parents are interested in your life, then this gives you the opportunity to learn some things and educate and share this information with your parents, because this is going to become part of your life. So again, Why do you do this? Many of you have no crystal ball to see into the future, but what I can tell you from my 25 years of experience and my personal experience, both of my parents have been dead for 30 years. I've been doing this for 25 years. Working with adult children and aging parents happens because adult children become caregivers for their parents who may not have known about all the health and money issues that they could have taken care of earlier in life. And so this becomes like a super stressful situation for the caregivers who become physically and emotionally ill for a lot of reasons around caregiving expectations of a parent. If you don't know this or you haven't experienced this yet, your parents may expect you to drop everything in your life. Your job, your spouse, your partner, your kids, attending school, stop seeing your friends, give up your free time, all to come and help them when they need help. This help can start out to be just a couple hours a week and grow to be majorly time-consuming, 30 hours a week or more. So it's like you have your paying job and then you have this unpaid job helping your parents. That can be exhausting. Your parents may not have known to save for their care, or maybe they just like spending all their money, which is why we're going to be talking about money in a minute. Some children contribute $1,000 to $3,000 a month to the costs of their parents' care out of their salaries or their 401k retirement accounts. This is a recipe for financial disaster for you as an adult child. But most kids do it because they feel guilty and they have a sense of duty and responsibility to care for their parents. If you have these conversations today, you may not be in that position later. If your parent gets diagnosed with dementia or Alzheimer's, or you have this in your family, those caregiving situations, way more demanding, and they last for a lot of years. And if you have siblings and you're the one that volunteers to be that caregiver, in many cases, your siblings, they are going to be nowhere to be found. They will be off living their lives, offering you zero help, having no interest in your parents, of course, until they die, and they're looking for their inheritance. Which is why it's important to talk about this today, hopefully years before your parents ever need care. These early conversations can save you from and prepare you for the situations I just described. There's many more in other videos here on my YouTube channel and on my podcast, The Caring Generation. So healthcare. In this instance, we're talking about healthcare as two words, not one word. Healthcare means your physical, your emotional, your mental well-being, how you feel day to day. Healthcare as one word means the business side of things. Health insurance, healthcare providers, doctors, hospitals, nursing homes, emergency care, vaccinations, all of that kind of stuff. So, we already established that your parents have an interest in your life. This can be good or bad depending on how much personal information you share with them. And honestly, you probably know this. If your parents are judgmental, the less you share, the better. But in this case, the idea is going to be you are going to share because you want your parents to learn about this. You're going to do research to help educate your parents, which in turn is going to actually help your parents, but in the long run, it's going to help you not to be their caregiver. Oh, before I forget, please do click the like button on this video, follow my channel, subscribe, share this video with your siblings and your parents and anybody else. So, healthcare, two things. Number one, what is your healthcare situation? How are you taking care of yourself? Do you have a primary care doctor? My guess is probably not if you're healthy. Here's why you want to have one. Preventative health and stopping problems you may have that you do not know that you have before they even start. So, If you're going to talk to your parents about this, get a primary care physician. Call your health insurance company, find out who is in network, and make an appointment. Go have that annual physical. Most of the time your health insurance pays for this, or you may have a small copay. The benefit to you is that you can start learning about health care and taking care of yourself. Now hopefully your visit goes well, but if it doesn't, and your doctor identifies something like high blood pressure or diabetes, or they run your blood work and you have high cholesterol or something else going on, the positive is you are probably, no guarantees, at the early stage where you can make a lifestyle change, changing your diet or exercising or doing something else so that you don't have to take medication. Now, while taking medication is an easy thing to do, it's a slippery slope to more health problems and more medications. Your elderly parents, if they have health problems already, they know this, and I'll talk more about this in a minute. So a couple of statistics to explain why seeing a primary care doctor for an annual physical is important and why your parents should be doing this if they're not. University of Michigan Health and Retirement Study, it's all over the internet, you can find it, confirms that 50% of people over age 55, this may be your parents or you if you're Gen X, 50% of people over 55 have 4 to 5 chronic health conditions: high blood pressure, diabetes, breathing problems, COPD, asthma, arthritis, cancer, or something else. Add to this, 45% of people diagnosed with cancer here in the United States are working age as young as 20, all the way up to 64. So, while you think you may not have anything going on with your health, you might. And the closer you get to middle age, the more likely you're going to have something that's undiagnosed if you don't go for your annual checkup. High blood pressure, often it has no symptoms. You don't know it. Women are even more prone to high blood pressure and not realizing that they have it. Diabetes is another thing. You can feel okay for a long time and have high blood sugar that turns into type 2 diabetes or type 1 diabetes, and then other health problems accompany that. So, research your health plan. Find a primary care doctor. Go and have that physical. Then, share that information with your parents, how you're taking care of yourself, and start asking them, what are you doing to take care of yourself? Because it's very difficult to suggest to your parent that they do something if you're not doing it yourself. You lack credibility. The benefit to you, again, catching health problems early with the goal of resolving them. If your parent already has a lot of health conditions, the best they can do may be to manage them and stop them from getting worse. But if they're still a little younger, like you, they may be able to catch them and do something else. So this is where all of your skills come together with this. Ask your parents who their primary care doctor is. Ask them if they're going for their annual checkups and their annual bone density exam and colonoscopy and mammogram and prostate exam and all that kind of stuff. Ask them if they have any health problems that you should know about that you might inherit. Then, research those health problems, learn about them and what can be done, and share this with your parents. There are plenty of disease-specific organizations out there with walk-in or online sites. American Heart Association, American Diabetes Association, Cancer Association, Alzheimer's Association. A lot to be learned. If you and your parents are not proactive about your health, a couple of things can happen. Your parents' health will get worse with age. They'll have conditions that they don't discover, and by the time they discover them, they're going to be like too far gone. Then you're going to become their caregiver. and your life can be significantly disrupted, as I mentioned before. We want to avoid all of this. For you, if you become that caregiver, as I said before, any free time you had to take care of yourself, it's gone. You'll miss your doctor appointments. You'll stop going to the gym. You'll stop spending time with your friends and your family that's good for you. You'll give up every single activity you love because you are going to trade that time where you took care of yourself to take care of a parent, especially if you are the female in your family. So basically, your health is going to suffer. You're not going to be a good example for your children if you have them. So be selfish. Start this conversation today with your parents for their benefit and for your benefit. If you don't know how to do this, have your parents watch this video. I will share this information with them. You can also schedule a one-on-one or a family meeting with me, where I can take you through everything that I've shared in this video and a lot more. Go to my website, PamelaDWilson.com, click on the Services tab, Elder Care Consultant, fill out the form. I'll also place a link below this video in the comment section, so you have to scroll all the way down to find it. So number 2 about health, use of technology for patient portals. If your parents are older and they have health problems, teaching your parents to use an online portal if they do not, and asking them to give you access can be very helpful. And while you're at this, again, make sure that you have registered for the online portal with your primary care physician so that you can tell your parents that you've already done this and it's easy and you know how it works and wow, it's a really great thing to do. If your parents give you access, you can check out all the notes from your parents' doctor's visits. You can see their list of health diagnoses, the list of medications that they should be taking, and any doctor's recommendations. If your parent is on Medicare or a Medicare Advantage plan, which means they're over 65, they're entitled to an annual Medicare wellness visit. Make sure they schedule it. And if you can, attend the appointment, even if you have to attend it virtually by your cell phone. Now, you might think doing this is a little intrusive and maybe it's more than you want to do. Here's the thing. You'll have more information to help educate your parents. And you'll find out if they've just been kind of going through the motions of going to the doctor and not listening to doctor's recommendations. You can also be direct and say, hey, I'd like to help you with this because I'm learning more about it myself. And then you can be blunt. Hey, I want to be healthy when I'm older. I'd like to help you stay healthier longer. And the side benefit is, I may not need to become your caregiver if you're healthy. Otherwise, if you don't take care of yourself, it's probably going to require some of my time, and I may not be able to give you that time depending on what's going on in my life. You got to get that conversation out there. Now, your parent is going to say something like, oh, I am never going to get sick and need care. Well, that's all about denial. That's never going to happen. It happens to all of us someday, whether we like it or not. And while your involvement today is going to seem like a time commitment, right? Think of it as a time investment. It's one of the best time investments you can make to avoid having your life affected significantly by becoming your parent's caregiver. It can affect your career, your ability to earn money, your marriage, your relationships with your children, your health and your well-being, all of that, like I mentioned. The effort on your part here will also prevent or delay your children from becoming your caregiver and their lives getting derailed. So this really is an intergenerational project. It's an intergenerational benefit. All these efforts go both ways. The idea is to limit the personal costs and the financial costs of caregiving in your family related to health care and money. So now let's talk about the 2 basic money topics. How are you saving your money? Are you saving your money? Are you saving your money for retirement? Do you have a 401k at work? Do you have a financial planner? How will you pay for your care when you're older? And do you even know what care costs? Let me give you a few numbers which can help you with opening this conversation with your parents. An in-home caregiver, not a medical caregiver, but a caregiver who helps with things like cooking and housekeeping and running errands and helping your parents bathe or dress when they can't do that for themselves. In today's dollar, $30 to $60 an hour, with usually a 2 to 4 hour minimum. So if you look at the high end of that, $240 a day to help your parents stay at home and get just a little bit of help that they need. Assisted living communities, all those places you drive by that older people live at. Assisted living, memory care, skilled nursing. Assisted living, depending on where you live again, $5,000 to $12,000 a month, depending on the services that your parents need. Memory care, $5,000 to $15,000 a month. The nursing home, same thing. So at the high end of care, $15,000 a month times a year, $180,000 a year. Who's going to pay for all of this? Most working adults don't earn $180,000 a year. And if they did, they need to take care of themselves, right? So if you and your parents don't learn about health care and money, if you don't learn how to save or invest or purchase a long-term care insurance plan, paying for care is going to be a problem. You can avoid this problem by having these conversations about how you are saving and planning and how your parents are saving and planning financially. So money item number 2 is talking about the costs of care with your parents. So you've already determined, am I saving, should I be saving, are my parents saving? Now you got to hit them with sticker shock, which probably hit you. Medicare doesn't pay for this type of care. It'll pay for hospital care and short-term care in a nursing home for rehab, but paying for help in people's homes, in assisted living, in memory care, in a nursing home for long-term care, Medicare doesn't pay for that. Along these lines, if you learn that your parents didn't save and they're out of time, maybe they're 65, 70, and they already have a lot of health problems. Planning for Medicaid is a practical step. If they're younger, a great option would be if your company offers long-term care insurance and you can buy it for your parents and have them pay all or part of that cost. That's a good idea, because company plans don't have qualifiers for health like plans on the open market. If you're trying to buy a long-term care insurance policy on the open market, they're going to want to know about your health. And if you have health problems, it could be more expensive. Long-term care insurance offered in companies is usually guaranteed issue, meaning that you're going to get it regardless of what problems you have because you're in a bigger pool of people, right? Easier to get. Most states realize that they have a problem with people not being able to pay for care. So they are going to start payroll deductions for long-term care. The state of Washington already does this. California, New York, and other states, it is coming. The problem is, if you move to another state, that benefit doesn't go with you, you lose it. The good thing is, if you have a long-term care insurance policy through a company and you leave, more than likely you can keep it. And that will avoid these payroll deductions like you're currently seeing for Medicare and Social Security. So, the big thing here is if you and your parents want choices about where and who will provide care and how you're going to pay for it, the more you learn about healthcare and money matters today and talk about all this information in your family, the better off all of you will be. So I recommend be selfish. Start the conversation today with your parents. If you don't know how to have it, again, share this video. Schedule a one-on-one individual consultation with me or a family meeting with me where I can take you through everything I've shared and more. How do you do that? Go to PamelaDWilson.com, click on the Services tab, and then Elder Care Consultant, and fill out that form. There will also be a link below this video in the comment section. You got to scroll all the way down to the bottom to find it. I'm Pamela D Wilson. I'm a caregiving expert and expert witness with 25 years of experience. I thank you all so much for being here. Please do click the button, like this video, follow my channel, visit my website, PamelaDWilson.com. I will see you all again soon in another video.